There are some major Medicare updates that you may want to be aware of as we are making our way through the annual enrollment period. This runs from October 15th through December 7th, and it is a small window of time where everybody already on a Medicare Advantage plan or a Part D prescription drug plan can make changes to their 2026 coverage options. Now, the first major update is the mass exit of several Medicare Advantage plans nationwide. This isn't the news, but the overall scale and impact of this news is more than even I expected. I had a video that looks like this that estimated over 1 million people would be affected, and as we are making our way through the annual enrollment period season, a great group that I highly recommend called Medicare Market Insights uses data from the Centers for Medicare and Medicaid Services, or CMS, and it shows that 2.9 million Americans who were on Advantage plans were affected by plan eliminations that include service area reductions in those plans. That is 10% of all Advantage plan beneficiaries. To give context, the percentage of those affected by Advantage plan terminations between the years of 2021 and 2024 ranged from 0.4% to 1.5%. For plans leading into 2025, that jumped to 7%. And it now stands at 10% for plans leading into 2026. Now, the major reason for this is a combination of the full implementation of the Inflation Reduction Act shifting more cost responsibility onto insurance companies for Part D prescription drug coverage, and then an overall surge nationwide of people accessing the healthcare system. This is not just for Advantage plans, it is also felt by those of you on Medigap or Medicare supplement plans, which I cover in a video that looks like this, where we are seeing record-breaking increases. The point is, I initially thought the Advantage plan exit would be a problem. It turns out it's an even bigger problem than we thought. If you are affected by your Advantage plan being terminated, please watch the video that looks like this and pay close attention to this next major Medicare update in this video. The second major update involves a severely strained relationship between insurance companies and agents or brokers. For most of you, you don't see or hear much from this side of the conversation. I don't really spend a lot of time talking about agents and insurance company relationships because it doesn't really affect you too much. Well, now it does. Many American seniors rely on brokers or agents like myself, my partners, and my friendly competitors to help navigate the different Medicare plans, the rules, the insurance companies, and updates to your plans. You do not pay anything for an agent to help you. Agents are compensated by the insurance companies offering the plans, at least those companies who are willing to pay. So, more than at any point before, we are seeing insurance companies remove their commissions to agents. Those savings are not just passed back to you, the individual who are using that insurance company, they are just kept by the insurance company. But it gets even more complicated, frustrating, and more nefarious in my mind. When an insurance company wants to offer a plan to the public, they submit what is called a bid to the government. This is for Medicare Advantage plans and Part D prescription drug plans, but I'm going to focus on Advantage plans. In that bid, they say, hey, we predict these costs for these plans. We are covering this level of sickness among our members. We perceive this amount of risk. The federal government approves or denies these bids and the funding of those bids. If that bid is approved, that insurance company is financially obligated to cover the risks associated to that bid and that plan, keeping it available for the entirety of the plan year. So if I do a bid and I get it approved for the 2026 year, I must honor that plan if I'm an insurance company through the entirety of 2026. I can't just turn it off in April because costs are getting to be too much. As part of that bid process, the insurance company marks that specific plan as either commissionable or non-commissionable, meaning the insurance company will pay agents who help with those plans or not. That commission cost is built into the bid approval process by the government. The government regulates those commissions and they set a maximum amount. So the government decides the maximum number that those commissions can be, and then most insurance companies set it at that number. Well, what we have happening across the country is insurance companies that marked their 2026 plans as commissionable in their submission and approval process have since told agents, nah, we're not going to pay those commissions for these plans. We'll just keep it. Some insurance companies have even gone so far as to say that we're not going to pay you for people you already helped in the past when we were paying on these plans. And then still other insurance companies have, when realizing that it's illegal in their existing contracts that they have with agents to do this, have tried to force agents to sign new contracts that allow this kind of behavior under the threat of removing all of the agent's clients from their care under that insurance company. This, my friends, is called coercion. So, we have some brave states and their departments of insurance who are calling out insurance companies on these unfair trade practices. Right now, it is only a handful, as in 4. The other 46 states have not done so yet. To make matters worse, insurance companies are doing something called suppressing plans. What this means is that they hide their plans from their public-facing websites. They do not allow agents the ability to place people on these plans, even if the agent doesn't get compensated and is still just trying to help somebody get on the right plan for them. It doesn't matter. People are shut off from signing up from these plans through the insurance company's website and agents. That insurance company had those plans approved for their bid in 2026. And they should not be able to turn these off. Insurance companies are hoping that they can hide these plans long enough during the annual enrollment period that they can get through December 7th without people knowing these plans exist and hoping that people aren't able to sign up for these plans because the insurance company either screwed up on their plan bid submissions, they didn't project their costs accurately, or they aren't showing enough profitability if a high volume of people went to that plan. Why does this matter for you? Well, because the federal government and its Medicare governing body, CMS, have intense anti-steering rules against manipulating Medicare beneficiaries and the plans that they can access. This is for both agents, like myself, and insurance companies. The government does not want agents or insurance companies inappropriately steering seniors to plans that are not in that senior's best interest. However, the current way that these insurance companies are suppressing plans and manipulating agent commissions, how could this not be seen as steering behavior? What else do you call it when an insurance company marks a plan as commissionable and gets paid as such, but then refuses to pay the commissions? Now, legal battles have started, but remember, the insurance companies just want to drag this out past December 7th, and then it doesn't matter as much. People are past their deadline of the annual enrollment period. This matters for you because if you live in a state that is suppressing plans or commissions, this makes it extremely difficult for seniors to find qualified help when it comes to plan selections around the plans in their area. Finding agents who are taking on new clients at no compensation is very difficult. A good agent who provides you with decent service cannot afford to help everyone at no compensation ever. For seniors who now have to go do this themselves, they need to leverage things like Medicare.gov and that website, which carries its own obstacles and hurdles. And this isn't just an Advantage Plan insurance company problem. Remember our first news story here. Advantage plans are being eliminated at high numbers. If your Advantage plan was eliminated, you can either get another Advantage plan or go on a Medicare supplement plan with no underwriting. But in most states, supplement plan insurance companies are not required to pay agents for their help either. I am not licensed everywhere. I can't help everyone no matter how much I wish I could. I have done my best to create video tutorials to help as many people as possible with Part D drug plan selections using Medicare.gov because drug plans no longer pay agents. I've tried to create a checklist for those of you who lost your Advantage plan due to termination and you are trying to get on a supplement plan. But I'm just one guy. I'm just one channel that most of the country doesn't get to see. That leaves millions of seniors left trying to find help but unable to find it. Now, where you live matters. Some states do protect seniors against these insurance company practices, others don't. Minnesota, I'm sorry, but you had one of the largest carriers, UCare, eliminate all of their Advantage plans for 2026. That's over 156,000 people in Minnesota who no longer have their plan available in 2026. And there are no commissionable Advantage plans in Minnesota. So if you don't have an agent helping you, finding one who is willing to assist you to find another Advantage plan is next to impossible. Why? Are agents just money-hungry monsters? No. There is actual legal and liability risks associated with agents making plan recommendations and helping people enroll. So do we really expect agents to take on the legal liability for a client and then take on the ongoing service requirements, all for no compensation whatsoever? There are many people who value that agent relationship, and they are offering to compensate the agent themselves. But guess what? CMS has imposed laws against agents receiving any compensation from Medicare beneficiaries. These laws have been in place for a long time, and I agree with them. If I were to accept compensation from you after advising you and helping you sign up for a Medicare plan of any type, Advantage, Supplement, or Part D drug plan, I would have my license revoked and I would be forced to pay fines. Some insurance companies haven't gone down this road, and they appreciate the role that agents have in helping people with the plans, and they still offer commissions. If you are having trouble getting help from an agent, now you know why. If you are considering reaching out to me for help, and this makes you nervous to do so and you don't want to cause more work, please reach out to me. I'll be direct, and I'll be honest with you around what is happening in your area. I will help as far as I'm legally allowed to, but I cannot promise the world if you're in a state that doesn't enforce the stoppage of this bad behavior, or you want an insurance company that is engaging in these practices. That was long. Thank you for sticking through it. Okay, the last update for you is the delay in releasing the 2026 Medicare cost updates. Last year, they released the upcoming new year premiums like Part B premiums, deductibles, IRMA thresholds, and other important costs around November 8th. I'm recording this on November 14th. We are coming off of a government shutdown, and they have projections out, but they have not released the official numbers yet. I like to work off of official numbers, not projections. There have been too many times where I've seen the projections not be correct. So as soon as the official numbers are released, I will have all kinds of videos for you, like the cost updates themselves, cost comparisons between Advantage and Supplement plans, actual cost comparisons for things like an eye surgery that a good friend sent in to me, and several other Medicare videos. So if you haven't subscribed already, please do so. It means more than you know. I appreciate you watching. The secret code word for this video is coercion, as if you've made it this far, you can guess why. If you are experiencing an Advantage plan termination, watch this video right here. If you are on a supplement plan and you are experiencing increases that are way faster than you would have hoped for, watch this video right here. I will see you over in one of those.